Hi everyone, I'm Cecilia Carrubias, and this is my presentation on gout. So before we really talk about gout, we have to talk about uric acid. So the primary source of uric acid comes from the degradation of purines. These purines are normally found in our DNA and RNA as adenine and guanine. So uric acid is a weak acid and has a pH about 5.8. So uric acid exits as urates, which is a salt of uric acid. And as urate concentration in the blood increases, uric acid crystal formation increases. The solubility of uric acid in water is low, and in humans, the average concentration of uric acid in the blood is close to the solubility limit, which is 6.8 milligrams per deciliter. When the level of uric acid is higher than 6.8 milligrams per deciliter, crystals of uric acid form as MSU, which is monosodium urate. And the breakdown of purines of uric acid usually occurs in the liver and intestines. So in this diagram is basically the breakdown of the purines, adenosine and guanine to form uric acid. There's like a lot of like through oxidation and hydrolysis, the final product is going to be uric acid. So the kidneys eliminate 2/3 of uric acid, while the GI tract will eliminate the other third. Almost all uric acid is filtered from glomeruli, while glomerular reabsorption and secretion regulate the amount of uric acid excretion. So the proximal tubule is the site of uric acid reabsorption and secretion. Approximately 90% is absorbed in the blood, while the other 10% is excreted. So hyperuricemia occurs as a result of increased uric acid production, impaired renal acid excretion, or a combination of the two. So hyperuricemia is a key risk factor for the risk of developmental risk of gout, renal dysfunction, hypertension, hyperlipidemia, diabetes, and obesity. You become hyperuricemic once your uric acid levels reach above 7 milligrams per deciliter. And in this diagram right next to us or in this little side picture is going to be a diagram of the nephron loop in the kidneys. So as you see near the glomeruli region, that's where everything's going to be filtered out. Yeah. So we're talking about uric acid a lot and reabsorption, excretion, what it is, and hyperuricemia. So now we're here on gout. So gout is an inflammatory disease that affects the joints due to hyperuricemia. So synovial fluid in the joints becomes saturated with uric acid due to hyperuricemia. Because the synovial joints have like a lower temperature and because uric acid also has a low solubility, the uric acid will precipitate forming urate crystals, monosodium urate, which is MSU. So these crystals are ingested by neutrophils and macrophages, and because of this, they trigger an immune response, which could be a gout flare-up. So my diagram is just basically showing that gout is mostly going to affect the joints. It is a joint disease. So gout flare-ups, which is basically like the sudden inflammation of gout, can last up to weeks, and usually the first 36 hours is the most painful, and then it kind of slowly subsides from there. So some common symptoms of gout would be sudden and severe joint pain, joint swelling, joint stiffness, and a mild fever because of the inflammatory response. So my fiance actually has gout. And when he has a gout flare up, it normally happens on his big toe, um, just the one big toe. And how he describes it is like severe 10 out of 10 pain. And he says like it feels like it's pressurized, it feels like it's gonna pop off. It's so hot. And the reason, and actually, because it's so hot, because the neutrophils and the macrophages, because the crystal is building up in that joint, the macrophages and the neutrophils like to like gang up on the synovial joint and like to eat it all up, and that's why it's so usually like hot, inflamed, and red. So how they normally diagnose gout is they're going to be doing blood tests to evaluate kidney function and a blood cell count. They're going to take some urine sample to see how the uric acid level is going to be. They might do a synovial fluid analysis in the joints to identify if there's any uric acid crystals in that surrounding area. And then for severe cases, they might do x-rays and imaging tests to evaluate the bone health, deformity, or see if there's any joint changes. So, in regards to gout treatment, lifestyle changes are effective in gout management. Regular exercise and diet changes would be best effective. Diet changes by avoiding inflammatory foods and foods rich in purines. So in this little diagram I have right here, it has some examples of foods that are rich in purines. Shellfish, seafood, mussels, shellfish, scallops, red meat, some red meats, organ meats, high fructose corn syrup, and processed snacks with excess sugar. And then it has a little diagram of what you can eat instead. So like lean red meat, poultry, fruits, vegetables, non-inflammatory foods. And then NSAIDs, colchicine, and corticosteroids to control pain and inflammation for gout flare-ups, and medications that control uric acid production, which is going to be allopurinol, febuxostat, and probenecid. So AI can be used to analyze data and spot trends in chronic diseases. So I found an article that was able to for gout that was useful for AI, and AI was able to detect the association between gout and depression and anxiety. Uh, it stated that chronic pain was correlated to depression and anxiety, and studies uncovered evidence of uric acid levels may be connected to anxiety and depression. So, how common is gout? It's a condition that affects 9.2 million people in the US, and within the last 30 years, the US has seen a 5.5% increase. The increase is expected to continue because of various factors, including the aging of the rising population and the popularity of the Western diet. Men are more likely to develop gout because they have higher uric acid levels in their blood. And then one study determined that the average 7-year survival rate for people with gout was around 85%. Of the remaining 15% with the condition, about 66% died from like cardiovascular disease, and other deaths were due to complications with either the kidneys, cancers, or infections. Some risk factors for gout definitely going to be obesity, hypertension, kidney disease, diuretics, some type of metabolic syndrome, and mutations and changes to specific genes. So I included some diagrams that kind of show um, gout cases. As you can see, more it affects males way more significantly than in females, um, especially if you're over 50, essentially. And then it has gout by ethnicity. So here are my references that I used for this presentation, and thank you for tuning in. I'll see you guys later.